everybody. I hope you're having a great night. We have a good topic on board that we were talking about today. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to talk about should you stretch a pulled muscle. So this is something that we address often, and I know a lot of people have questions about it. Pulled muscles are very common. Hamstrings, which is back here, seem to be the most common. Gastroc back in here, another popular muscle. Sometimes you can also be talking about a sprain. That's more in the joint though. So if you're talking about a sprain, you're going to feel that more like at the knee or at the ankle, not necessarily a pulled muscle. So in your arm, you know, we get a lot of pulled muscles in the neck, sometimes in the bicep. Those are some more common places to get those, what they call pulled muscle. So what is a pulled muscle? A pulled muscle is just a muscle that got stretched too far. So you have to be careful when you are dealing with a pulled muscle, because a lot of times again, what people classify when they Google it as a pulled muscle may not actually be a pulled muscle. Sometimes it could be a little bit of a tear in the muscle, and sometimes the pull and the tear go hand in hand. The tear is not something that's generally alarming. I'm not talking about an Achilles tear where your muscle rolls up the back of your leg, or a biceps tear where your muscle rolls down your arm. And we get these micro tears in our muscles every day. So it's not uncommon for a tear to happen in the muscle. Again, a lot of people that'll have an MRI that say, okay, there's a tear in a muscle, and unless it's actually kind of, like I said, detached like an Achilles or more of a bicep, generally that will repair itself, and it's something that you do need to have treated, and it's something that you do want to not push through. So one of the most common things that I see and I've been asked about and really derail healing is stretching a pulled hamstring. So the answer is, should you stretch a pulled muscle? And the answer is no. Yet people really seem to enjoy doing that for some reason, and it winds up getting them in a lot of trouble. So a pulled muscle is a very generic term. Again, you have to find out what's actually going on, and I talk about this in every video I do. I want to give you the simple box little answer, and it never is. It's very complex. Why did you pull that muscle? Why did you get pain in that muscle? You have to find out why you did it, and did you stretch a tendon? Did you stretch the belly of the muscle? What's going on? Is there a tear in there? A pulled muscle generally, I'll put it in this one little box for you, is due to weakness. Okay? So when you think of a pulled muscle, the last thing you think of doing is strengthening that muscle, but it's actually due to weakness. And this is where people get themselves into a lot of trouble, because there's a lot of compensation going on, because people will just try and stretch it and they'll rest it, making it weaker, and then they try and go back to their normal activity, and they may be able to for a while, but it could be a pulled muscle again. I can't tell you how many times I've seen a patient with a repetitive hamstring strain. Like, I must have pulled this 10 different times. That's a sign of a vicious cycle going on, because what happens is when you pull a muscle and then you rest it, you are causing it to get weaker. You cause it to get weaker, it will then pull again. And whatever that pull is, whether it's a tendon, whether it's a tear, whether there's something going on, you will wind up in this vicious cycle. So NFL players are known for it, and I'm always baffled by how many hamstring strains there are, because they should know better, and they should have medical teams that know better. But it is not something that you should rest. It's actually something you should strengthen. But you need to have a supervised strengthening program. It's not something I recommend just saying, oh, here, do these exercises or do that exercise. It's really important that you strengthen the muscles in a sequential manner, and you strengthen the muscles so that you don't continue to injure that area. But you absolutely should never stretch a pulled muscle. And you shouldn't actually, once you feel pain ever, like, you're done stretching. So I know I see a lot of people being stretched out. That seems to be one of the new things pre-COVID. People getting stretched out. And I see wincing. that there should never be wincing when you're stretching. That's not a goal. It's not a no pain, no gain type of activity. It should feel good, and that's it. So if you're trying to stretch your way through a pulled muscle, you are actually causing further injury to the muscle. So it is going to cause this vicious cycle again. All right, so if you're someone who pulled the muscle and you've pulled it again, it means the last pull didn't heal. You kind of weakened it a little bit more, and then you went right back to it. So when you're dealing with any type of pulled muscle, whether it be in your neck, whether it be in your arm, whether it be in your leg, you need to find out why that muscle failed. What's weak? Where is the weakness? Is it a whole complex that's weak? Is it a muscle that's weak? How exactly do you go about fixing that area? And that's important to diagnose. And I will say it again, it is important to find out why you pulled the muscle. Where is that weak? If you just go and you just wind up treating the pulled muscle and you put some tape on it and you put some ice on it, you're going to stop the pain and you're going to stop the inflammation. You're not going to fix anything. You're just allowing that muscle to stop hurting. And it will, but it won't be fixed. So when it reoccurs, you can say, oh yeah, Heather told me this was going to happen because you didn't fix anything. Ice is a great way to eliminate edema, eliminate swelling. That's about it, okay? It doesn't fix anything. So you really need to address the issue. And when you're talking about a pulled muscle, you've got to find out why it is pulled. And it is 99.999% of the time weakness, okay? So finding the area of weakness is extremely important. But never, ever, ever should you stretch a pulled muscle. What you should do, besides the weakness, is you actually should move it. Gentle moving. So have you ever woken up with a stiff neck and then you're like in the shower and you're moving it and it's like, oh, it feels better. Same thing with a pulled muscle. If your muscle is sore and you've pulled it or you feel that pulling sensation, work in a range of motion that you feel good. Again, you don't want to cause pain. Any type of pain means you're aggravating that area. So if you've got, a neck pull, work in, doing some circles, just some gentle range of motion. And even if it's the smallest range of motion, getting that muscle active again is going to help start that healing process. You're going to have to address the weakness eventually, but instead of stretching, you simply want to move. You want to get that muscle active. You want to make sure there's enough blood flow going to that muscle. If you or someone you know is suffering from a pulled muscle and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.